Education is actually an ongoing event in anybody's life, especially so with a doctor and especially so with a gynecologist. So what are we talking about education? This is actually nurturing a whole new generation of future gynecologists to deal with what they may actually face in the future. We as gynecologists who have been practicing for more than 30 years have actually battled with many diseases, maternal mortality. We have tried to overcome many diseases in the past. But the future is pointing towards preventive oncology. What exactly is preventive oncology? It is prevention of diseases which can be prevented and concentrating mainly on prevention of cancers. And luckily, technology has provided us with enough to cope with these. Not only this, how do we deal with diseases that we see in pregnancy? A lot depends on screening for possible complications even before getting pregnant. That is, we're talking of pre-pregnancy counseling, while even premarital counseling is advised. So if we were to actually go through, screen for certain common diseases, try and find it early and probably take some preventive measures, we can actually prevent these diseases from coming on, and that would actually take away at least 50% of the burden of anybody's practice. So let us now look at what else we can do. For example, late marriages. Now these are something where certain peculiar conditions can be more present in women, say after the age of 30 or 35. So creating awareness amongst the public, amongst women who would go in for childbearing in the next 4 or 5 years or perhaps even a little later. Concentrating on teenage girls in colleges are all things where we can actually improve the quality of care, quality of health. So we as gynecologists of the present owe it to our younger colleagues to nurture a whole new set of young, new gynecologists with a view to providing good health care for the entire nation.